Hi, my name is Mary Green Brown, and I'm a neuroeducator. Thank you for choosing us for your spinal care. Today we're going to be talking about ways to make your spinal surgery more successful. There are many issues that can occur with your spine, and your neurosurgeon will help you determine which surgery is going to be best for you. Your surgery will be scheduled by your neurosurgeon, and you will be contacted by pre-admission testing to tell you when to arrive to the hospital to get pre-surgery labs and tests performed. They will notify you as to when to stop eating prior to surgery, what day and what time to arrive for surgery, and they will also let you know what medications to stop taking. Please notify your surgeon and the pre-admission testing staff of any herbal medications, any over-the-counter medications, and any blood thinning medications that you are taking, as some of these medications can affect your bleeding times and they will need to be stopped prior to surgery. Because you will have limited mobility, we recommend that you arrange for help prior to surgery, especially if you live alone. We also recommend that you remove any tripping hazards, anything that's on the floor that can cause you to trip, such as rugs or extension cords. We also recommend that you put items at waist level so that you can maintain your restrictions. Nicotine-containing products can delay wound healing and prolong your recovery. We recommend that you stop nicotine products prior to surgery. Southeast Health offers tobacco cessation classes to help you with this transition. Be prepared to stay at the hospital for 2 to 5 days, depending on the type of surgery that you have. Chronic conditions may also prolong your length of stay. Bring your back brace with you or your neck brace with you if your provider gave you one prior to surgery. Regarding clothing to bring, we recommend that you bring comfortable pants such as lounge pants or pajamas, anything with an elastic waistband. Avoid bringing blue jeans or anything tight-fitting, as these can rub against your incision. Regarding footwear, bring comfortable shoes, but we want to make sure that it's fitting properly and that you are not wearing items such as flip-flops or sandals without a back, as these can cause you to trip.
Hello, I'm Brooke, and I'm an occupational therapist at Southeast Health.
And I'm Dana. I'm a physical therapist at Southeast Health.
Today we're going to be talking about our role in your recovery process, as well as your spinal restrictions that you'll be following after surgery, and equipment that may be beneficial to you for your recovery. Depending on what type of surgery you have, your surgeon may order physical therapy and occupational therapy to work with you while you're in the hospital. Our job is to assess your mobility and self-care skills while educating you on your restrictions, wearing your brace correctly, and ensure that you're performing your exercises correctly.
It is important to become familiar with your spinal restrictions before your surgery. After having a back surgery, you will be limited in mobility, such as no bending, no heavy lifting. We usually like you to keep 5 to 10 pounds in mind as your lifting restriction, and then no twisting. You will have a sitting restriction, usually after surgery, 30 minutes at a time. That means you can sit up in the chair up to 30 minutes, then we'll want you to stand to change positions, then you may return back to sitting. You can continue this pattern all day long. Depending on the type of back surgery, you may be required to wear a brace. Your physician will give you this in the office, and we will help educate you on wearing it and being compliant with it while you're in the hospital. To put on the lumbar corset, you will start in a seated position. You will place the back brace against your back. And bring the front components around to put them together. Now you will take the stretchy straps on the side and pull them around. If you have a neck surgery, cervical precautions will be in place. Again, we don't want you to bend or twist your neck. You will have a collar that you will wear most all of the time. You will be able to take that collar off when you are eating and or bathing, depending on your surgeon's orders.
This is the Miami J cervical collar. It comes in 2 separate pieces. First, you want to locate the wording on the front where it says front and up, and then on the back, It says back with arrows pointing up so that you know you're putting it on upright. The front piece will be set first, right underneath your chin. The back piece will be centered in the back of your head, this part lined up with your spine. When you're ready to fasten the straps, you want to form the front piece around your neck and then tightly pull the straps on each side to connect to the Velcro. Once it's in place, ensure that all of the padding is in place so that no plastic is touching your skin or pushing into your skin. When you're ready to take it off, you can just undo one strap. Then the brace can stay as one piece to make it easier to refasten to put back on.
After your cervical surgery, you will not want to lift over 5 to 10 pounds, no overhead work, and we do not want you to bend over and pick things up off the floor.
In order to follow your spinal precautions while performing basic self-care tasks, there may be some tools that are beneficial to you to complete things like bathing and dressing without bending and twisting. These tools include a sock aid to help put your socks on without bending over, a reacher to help get your legs into pants without bending or to pick things up off the floor, a long-handled sponge to wash your legs and feet without bending over, and a long shoe horn to help get your heel into the back of the shoe without bending. Additionally, you may benefit from a shower chair to increase your safety while performing these tasks without bending over to reach your feet.
There are also a few exercises that you can start doing prior to your surgery to help strengthen your back and get ready. These exercises can also be done after surgery. After spinal surgery, you will perform log rolling to get in and out of bed. You will start in the seated position. You will go down onto your elbow and bring your feet up to be on your complete side. Once laying on your side, you will roll to your back. Now, to get back out of bed, you will bend your knees up first and then roll to your side. Once laying on your side, you will bring your feet forward and push up with your arms until you are back in the seated position. In this seated position is where you will put your lumbar brace on before standing and going about your activities. To perform a quad set, you will lay on your back with one leg bent with your foot resting on the bed and the other leg straight out. The leg straight out, you will start by pushing your knee down into the mat, which makes the top of the quadricep muscle on your thigh contract. You'll hold this position for 2 seconds and then relax. You will repeat this exercise as indicated in your book. To perform a heel slide, you will start with your right leg and you'll slide your heel along the bed up towards your bottom to a comfortable position, and then you'll slide your heel back out to straighten out your leg. You'll repeat this on your right leg as indicated and then switch over to repeating it on your left. To complete a pelvic tilt, you will start on your back with both legs bent and your feet resting on the mat. You will tighten your core and think about bringing your belly button down into the bed and rolling your hips back. You will want to hold this contraction for 3 to 5 seconds and then relax. You will repeat this exercise as indicated in your book. For gluteal sets, you will start on your back and straighten your legs out. For this one, you will want to tighten your gluteal muscles. These are your buttock muscles. So you will tighten your buttock muscles, hold 2 seconds, and then relax. You will continue this as indicated in your book. You will start on your back with a rolled up pillow or blanket under both of your knees. To support your back, you may bend up one of your knees and rest your foot on the bed. You'll keep the other leg straight and over the pillow. The leg that is straight, you will focus on raising your foot until your knee straightens. Hold that contraction 3 to 5 seconds and then return back down. You'll repeat this exercise as indicated on your book on both legs. You will start on your back and extend both of your legs out. Keeping your legs straight, you will bend at your ankles and bring your feet up towards you and then point them straight. You will continue that motion as indicated in your book. You'll start this exercise in the seated position. You'll slowly straighten one of your knees so that your leg is straight out in front of you. Hold it, then lower it back down to the starting position and repeat. You will want to try to keep your back straight for this exercise.
On the day of surgery, you will go to the patient registration area to check in. From there, you'll go to the surgery department. You'll have an IV inserted. You'll be able to talk to the anesthesiologist, and your surgeon will come in and talk to you before surgery to answer any questions you may have. After surgery, you will go to the recovery area. Your family will talk to the surgeon, and he'll talk to them about how the surgery went. They will also receive your room assignment. Most spine surgeries are associated with some level of pain, but everyone's pain is different. Our goal is to treat your pain and make you as comfortable as possible, and we'll work with you and your neurosurgeon to meet that goal. To evaluate your pain, the nurses may ask you to rate your pain on a scale of 0 to 10, with 0 being the least amount of pain and 10 being the worst pain. The nurse may also ask you to compare your pain that you're having now to the pain that you had before surgery. After surgery, patients may have pain in the incision or muscle spasms. Your doctor has IV medications and oral medications to treat both of those types of pain. Some patients may have patient-controlled analgesia pumps or PCA pumps. This allows the patient to press a button to get IV medication immediately to treat their pain. Our goal is to have you taking oral medications and have your pain controlled orally before discharge. It's important to note that repositioning, getting out of bed, getting up and moving will help to loosen tight muscles, which can also help to alleviate pain. We also have ice packs, which can be used to help relieve pain. It is important that you alert your nurse that you're having pain before it becomes too severe, and also to let her know if the pain medicines that you're receiving are not effective. Please let staff know if you're having side effects of medications such as nausea, vomiting, or itching. After surgery, most patients can eat a clear liquid in advance as tolerated to solid food. Lumbar surgery patients with an abdominal incision are usually not allowed to eat for 1 or 2 days. This is because the stomach is still sluggish and feeding them too early could cause nausea, bloating, or vomiting. It is important to know and maintain your activity restrictions until cleared by your neurosurgeon. Lumbar surgery patient restrictions include no bending, lifting, twisting, or stooping. We refer to this as no BLTs. Wear your back brace anytime that you are out of bed. Neck surgery patient restrictions include no pushing, no pulling, and no excessive turning of the neck. You should wear your collar anytime that you are not eating or bathing. Walk several times a day and increase your activity as tolerated. After surgery, you will have leg wraps applied to your lower legs. These wraps are attached to a pump which will cause them to inflate and deflate at regular intervals. The purpose of these leg wraps is to prevent blood clots. You should wear these wraps anytime that you are in the bed. This device is called an incentive spirometer. The incentive spirometer measures how effectively your lungs are expanding anytime you take a deep breath. The purpose of this device is to prevent the development of pneumonia, and nursing staff will teach you how to use this device. You should use this at least every 2 hours. After surgery, you may have a drain coming from your incision. The purpose of this drain is to remove secretions from the wound bed. The nurse will empty this drain about every 8 hours, and the drain can usually be removed after about 24 to 72 hours. You will not be discharged home with this drain. While at the hospital, please call for assistance anytime that you're getting out of bed or out of the chair. Remember, call, don't fall. Notify staff if you have increased trouble swallowing, increased shortness of breath, increased pain, or anything that is causing you concern. Refer to your booklet for more information. In order to be discharged home, you need to be walking, you need to have proper bowel and bladder function, and you need to have good pain management. Your doctor or nurse will show you how to change your dressing. Typically, we will have patients use a dry gauze and tape. If you've had a kyphoplasty, we'll have you use Band-Aids. Social services and case managers will assist you with your discharge plan. Please notify your physician if you have any questions or concerns. Once you're home, reasons to call the physician include signs and symptoms of a wound infection, trouble with bowel or bladder, increased uncontrollable pain, or anything that is causing you concern. We know that surgery can be a frightening event. Rest assured that we have experienced staff interested in your welfare. Please reach out to us before surgery or even after surgery if you have any questions. Refer to your booklet for our contact information, and thank you for choosing us.